This terrified terrier needs Dr. Barry.
He's got some issues with anxiety and itch, and then all of a sudden he gets attacked by another dog.
While a second attack has left Barry's team with some tough choices.
It's bad. It's very infected. I'm actually worried that the globe of the eye is very close to rupturing.
And as Dr. Barry is called back to the wild,
I'm a little concerned about the upper piece of bone that may be shattered more than I can fix.
a Great Dane has beat him to it.
She must have found it in the ditch, and next thing you know, she had a bunch of quills in her chin and a bunch of quills in her legs.
How will Charlotte ever survive such a prickly encounter?
You want a break? Take a little break.
I've been a veterinarian for 20 years. Oh, he almost got me. I've helped everything from a monkey to a moose. I'm walking a beaver. What I like best is helping people with the animals they love. Welcome to my clinic. I'm Dr. Barry.
On Canada's East Coast, Dr. Barry's vet clinic has been up and running for months. With a top-notch staff and animals streaming in, it's beginning to feel like a well-oiled operation.
Things are coming along really well. We have a great family of staff here, as well as, you know, our clients and our patients are part of our family too.
Rosalind and Kate have been part of Barry's family for more than 10 years. And today they need help with terrier Sammy. He's taken a turn for the worse, just as they're leaving for vacation.
This is Sammy. Sammy was bitten by a dog about a week and a half ago. We actually are going on vacation tomorrow morning, so we're trying to make sure he's okay for our pet sitter. He just started throwing up yesterday, and he's really started itching a lot, so he's chewing at himself, and we want to make sure Dr. Barry sees him and make sure his healing's good. Come, Sam.
Are you ready for Sammy?
Okay.
Their flight is just hours away.
We're going to see Elton John. Neither one of us have ever seen him, so we're thrilled about that.
But they won't be going anywhere without Dr. Barry's blessing.
You're all right.
Little Sammy's got a lot going on with him. You know, he's a great little dog, but he's got some issues with, you know, anxiety and itch, and then all of a sudden we throw into the mix, he gets attacked by another dog. Hey, how are you guys?
Hi. Great, thank you.
Hi now, Sammy.
He is.
You got beat up by another dog.
He did.
Huh?
He did.
That wasn't very nice, but he's recovered from that, okay?
He seems to be. He seems to be. I just wanted you to take a look at it because I'm thinking the itching might be because of the antibiotics and the throwing up. Don't know. Because we're supposed to be vacationing tomorrow, and he's going to be with the sitter, so we can't really monitor if he's throwing up.
How long are you going for?
5 days. 6 days.
6 days? Okay.
Yeah.
Dr. Barry checks the original bite wound. And he looks for signs of new problems.
If we talk about the vomiting first, I mean, vomiting the list of reasons, same as
Yes.
you and I.
Yeah.
A mile long, right?
Yeah.
And so I kind of go by, you know, are they having diarrhea?
No.
Which he's not. Still wants to eat,
Yes.
right? So he's not really acting sick, but he's
No.
vomiting, so there's something inflamed in there.
Barry suggests a dose of motion sickness meds. He thinks it'll be just right after Sammy's wild ride.
Just for a couple days, and put him on a bland diet.
Okay.
And for the itching, a simple injection.
Okay, bud?
Where do you want him?
Let's point you that way. Just
right.
very right-handed when I give needles. And it's just going under the skin, just like a vaccine.
Good boy. Good boy.
So we gave him an antibody injection to try and control the itch, in the hopes of just making him feel better again so that, you know, moms can feel better and they can go away and enjoy their vacation. You a bit shy on treats?
Well, maybe I will, he says. Oh, Dr. Barry, you have the magic touch.
Based on my exam, I feel pretty comfortable telling them that Sammy should continue to improve and they can go away and enjoy themselves.
It's a clean bill of health for this tiny prancer. And for Rosalind and Kate, a thumbs up to see Elton John.
Woohoo! Okay, all right, Sam, let's go.
Come on. Let's go, buddy.
All right. Oh, he's like, woohoo!
But they all know Sammy was lucky. Dog attacks can be a life or death situation if they aren't treated fast. Today, Dr. Jessica is with Baloo, a Pomeranian pup who's been bitten in the eye.
The infection is pretty severe, and at this point I worry that leaving it longer, it could spread further into the bloodstream and cause septicemia.
Septicemia occurs when an infection becomes systemic, meaning it's spread through the entire body. Also known as septic fever or blood poisoning, it can be fatal.
Baloo is getting his catheter placed so that we can give him his IV induction medications to put him under anesthetic for surgery.
The induction meds will provide a light sedative, allowing vet techs Bonnie and Kirsty to complete their prep work quickly.
So there's a few things we do in the lead up to getting patients into surgery. We place an endotracheal tube, which is a tube that basically goes right into the dog's airway so that we can deliver oxygen and the gas anesthesia. When choosing the size of the tube, it really needs to be accurate. If it's too big, you can cause damage to the trachea. If it's too small, they could be breathing around the tube. Maybe they won't stay under anesthesia very well.
With Baloo now fully sedated, they'll shave the area Dr. Jessica will operate on.
We need to make the area kind of as sterile as possible. So obviously an animal's hair, as clean as you can get it, it's still not clean enough for surgery. We don't want any hair going into any kind of an incision. And then we also scrub the area with a surgical scrub.
Now Dr. Jessica gets a close-up look at the situation.
It's bad. It's very infected. There's a lot of material kind of coming out of the front of the eye. I'm actually worried that the globe of the eye is very close to rupturing.
The attack has left Baloo and his owners with little choice. His eye must be removed to survive.
It's not a surgery we take lightly. We really only do it if we're really, really sure that there's just either no way we can control pain associated with glaucoma or there's trauma there we can't repair. There has to be a good reason that we have to take that eye out. So to take the eye out, step one is actually making a little incision outside of the eye just to give yourself a little bit more space to work with. And then using either scissors or a scalpel blade, you just kind of dissect all of the tissues and the muscle that connect the eyeball and kind of hold it in place.
It's a slow and painstaking process.
And that can be tedious and it can take time. You can feel like you're almost there, but it still won't quite turn, so you just have to keep digging and digging until you actually sever all those attachments.
But she needs to complete the procedure. The longer the surgery, the higher the risk.
In any patient, anytime you prolong anesthesia, you prolong risk, and it's riskier to the patient, to their internal organs, to their heart, to their lungs, the longer they stay under anesthesia. So we want to be in and out as quick as possible, but also do the job right. So it's kind of a balancing act between the two.
While Dr. Jessica tends to Baloo, Dr. Barry's been called to assist a local wildlife rehab center. Hope for Wildlife is where Barry spent years helping injured and orphaned animals. It's where his medical career took off. And today they have an injured owl with a broken wing. Dr. Barry thinks he might be able to fix it.
So far, things are looking pretty good. It's not an open fracture, so there's no bone sticking out, so that's a good thing as far as getting ready to take things to surgery. So I'm just going to start by taking some x-rays, and then we'll decide how the rest of the day proceeds for this little guy.
But it won't be easy. First, Barry must make sure the owl is a good candidate for surgery.
And then we're going to put this one over my hand, and we're good to go as soon as you guys leave the room. Can we give him back to you?
Yep.
Like that. See, the elbow joint is fine, and the shoulders look intact. I think it's worth giving it a try, and we'll take him to surgery and see if we can fix it.
The plan is to slide a pin inside the owl's bone to align the pieces while they heal.
I'm a little concerned about the upper piece of bone because on the x-ray it's not showing as a intact bone, so it may be shattered more than I can fix. The lower part of the bone certainly is still intact, and so the plan is we're going to put the owl under an anesthetic and fix its broken wing. My hope is that there is enough open bone there that I can get a pin into. I'm just going to turn on the gas. I wonder if I could get a quick look at his mouth. Just so I know what size tube I'm going to need. Okay, that's in. Good?
Feels better, yeah.
So I can feel one end of the bone right here.
Barry's examination reveals the injury is more serious than he thought.
We didn't think it was an open fracture, but it does seem to be. You can actually see the end of the bone right there now.
But he still wants to go for it. Without this surgery, the owl has no chance of survival.
Thank you. So check.
Like many birds, owls have hollow bones that make them lighter, helping them fly. That empty space makes this pin surgery easier.
I find the longest part of this is getting the bones where I need them to be so that I can align everything. So with the pin, what I'm going to do is this is the lower part of the bone, so right here, I'm going to actually advance it up through the shoulder and exit the bone at the top, and then I'm going to align the bone and push the pin back into the lower part of the bone.
Barry can't see exactly where the pin is inside the wing.
So there's the end of the pin coming through the other end of the bone. So I'm going to push it through so that I can get the lower piece aligned.
He's flying blind. He won't know if it's in exactly the right place until he checks the x-ray.
Okay, let's get an x-ray of that. I'm okay with that. There's a wall missing off the side of the small piece. So I have one wall nicely aligned, or one side of the bone, and the other side just kind of has a gap in it because there's no piece there. But with time, that should fill in, and the pin is keeping things pretty straight there. So I'm happy. We're gonna give him a chance anyway.
While Dr. Barry is inserting pins, back at the clinic, Dr. Taylor is removing them. Dozens of porcupine quills embedded in Charlotte, the Great Dane. It's a rural pet owner's worst nightmare.
We live in the country, so we do due diligence, checking the yard there all the time before we let her down. So I went down, checked the yard. She comes down, does her business. She must have found it in the ditch and decided she wanted to see what it was all about. And next thing you know, she had a bunch of quills in her chin and a bunch of quills in her legs.
Porcupines have roughly 30,000 quills, so the damage could have been worse. But that's little consolation to this Great Dane in great pain. And there's another problem. While Charlotte's been given medication to control the pain, she can't be put under. Vet Tech Nicole and Dr. Taylor will perform the procedure while she's awake.
Because she has a lot of chronic issues, one of which relates fairly strongly to her respiratory tract, we wanted to do things as quickly and efficiently as possible without overly sedating her.
They begin by removing more than 40 razor-sharp quills from her hind foot.
The quills in the foot are not as deep, so it's just skin on top of bone oftentimes, so they're easier to get out.
But when it comes to the face, it's a different story.
The muzzle is just more irritating to the dog. Definitely fattier, thicker, jowlier. Charlotte, for example, is a Great Dane, so she's really jowly.
There's no simple way to do it. They reassure Charlotte as best they can and wrap gauze around her mouth for their own protection. Anything else would drive the quills deeper. Then they carefully remove them, one by one.
There's so many nerve endings and everything, so they're usually pawing and breaking them off or driving them in deeper, so it's harder to get them out.
It's tedious for Dr. Taylor and Nicole, and even tougher for Charlotte.
You have to really get a good grip on the base to get them out, and the dogs are usually not tolerant of that either.
Porcupine quills are one of nature's nightmares. Covered in hundreds of tiny barbs, they push into flesh smoother than a hypodermic needle, but rip through layers of flesh as they're removed. And Charlotte can only take so much pain.
You want a break? Take a little break.
They give the brave Dane a break.
So we want to get your quills out and keep you comfy, but
We don't want you to go into respiratory
we don't want
distress.
you to go into respiratory distress.
Okay.
Then begin again, down to the final few quills.
Let me take this off.
Finally, after what must have seemed like forever, Charlotte is quill-free. Dr. Taylor inspects the job. Now to show parents Scott and Pamela the results. It's one of Dr. Taylor's favorite parts of the job.
Yeah, they're always pretty relieved to see the quills gone, and they're usually pretty relieved to see them walk out on their own steam. It's a nice feeling for them.
She's a little groggy right now because she's really not sure what she needs to do with herself at this point in time. So hopefully she'll sit down and relax for a little bit. She just wants to go, I know that, wants to get out of here and get in the van and go home. So it's been a challenge actually since we've gotten her, but she's our family. So at the end of the day, it's what it is. So we do what we need to do to make sure that she's healthy and stays around for many years, eh, pup?
Everyone's glad Charlotte will go home safe. At Burnside Veterinary Hospital, Dr. Jessica is working overtime to remove an eye and save a cherished member of the clinic's animal family. The procedure is so challenging that Dr. Barry, exhausted from his own work, has returned to check in.
Eye surgery or eye enucleation is not a very fun surgery. It's a little bit unpredictable because you're working in a dark hole and you're kind of going a lot by feel more than for what you can actually see.
Barry's glad Jessica is up to the task.
Now that I have her trained to do them and she's good at doing them, it's kind of allowed me to get away from doing them a bit.
Jessica's already cut the tissue and muscle surrounding Baloo's eye. But when she tried to insert a clamp and slice the eye from its socket, things went downhill quickly.
In Baloo's case, just a simple increase in pressure in the eyeball. I think because the cornea was so compromised, it actually caused the eyeball to explode, just because there wasn't enough strength in the front of the eye to kind of keep all that fluid in.
The eye is disintegrating with every minute that passes. The socket's full of blood, making it impossible to see.
I try to place some pressure because if you place pressure on the blood vessel, even if it's just for a couple seconds, when you lift off that pressure, you do get just kind of a split-second window where you can see a little bit better what's going on before it starts to fill up with blood again.
It's prolonging an already lengthy surgery. Jessica must rely on her training and instinct.
I guess I just tell myself, like, this is my surgery, this is my patient, so I guess that's kind of scary in a way because you're putting a lot of pressure on yourself, but it just kind of helps me focus. Just take some deep breaths and get it done.
Dr. Jessica has to remove every ounce of eye tissue. If she fails, she'll have to repeat the procedure, putting Baloo at risk all over again.
There's a lot of glandular tissue in the eye that secrete tears. So even if you remove the eyeball, if you leave behind that glandular tissue, they can actually leak a small amount of fluid. So if that's the case, then I would actually have to go back in and find that tissue and remove it.
Finally, after extensive digging, cutting, and persevering, Dr. Jessica is exhausted. And while Baloo has lost an eye, he's going to live to see another day.
Surgery's finished. Ultimately, I feel like it went as well as it could have. I feel like I did get all the glandular tissue out of there. It closed very, very nicely. And the biggest thing for Baloo is for about the last week, I think he has been in a lot of pain. So I'm just happy that I was able to remove that source of pain for him. And I think he's going to be a lot more comfortable now that the surgery's done. And I think the owners are going to be happy with that.
At Dr. Barry's, a few weeks have passed, and there's good news all around. After a frightening dog bite, little Sammy is slowly making progress.
He's fine. He's healing. He seems to be using his foot like before.
While Rosalind and Kate enjoyed Elton John on their trip of a lifetime.
It was awesome. It was awesome, yeah. He played for 2.5 hours, a little over 2.5 hours. Everything that we knew and some things we didn't, and rocking. It was great. It was awesome.
Baloo dropped in for a visit too.
Hi, little guy. Oh, you still like me? Oh, hi, thank you.
To have his stitches removed and make sure life with one eye is going as smooth as possible. His owners were so grateful, they left Jessica a token of their thanks.
Dr. Jessica and the rock stars of Burnside Vet, I cannot thank your team of rock stars enough. You are a group of the most caring, understanding, and beautiful humans. From the front desk to behind the scenes in the clinic, I saw what an amazing place this really is. You didn't just help Baloo, but you helped me as well, and I thank you with my whole heart, Cassandra and Baloo.
It's been a great few weeks here. It makes me happy to be able to see such a variety of animals. My heart is truly with the families and the family pets, like Sammy, Baloo, and Charlotte. Don't be taking on those porcupines. You know, it also makes me, happy that my staff is able to do what they enjoy doing and what they do best. And, who knows what the future holds, and it's on to the next adventure.